Hi, I'm Jim and I was retired. Today we're tackling a big concern for 2026, and that's rising healthcare costs. Medicare trustees and industry reports project higher premiums for Medicare and ACA Marketplace plans. Plus, there's the end of the enhanced ACA tax credits in 2026. Stay tuned for 5 practical ways to deal with all of these pressures. But first, I think we have to all prepare. Caution! Rising healthcare costs ahead. Now let's dive into the details. First, Medicare costs are climbing. The 2025 Medicare Trustees Report projects that the Part B premiums will rise 11.6% from $185 a month to $206.50 a month. That's nearly double the 6% increase we saw in 2025. Now, the Part B deductible, which is the cost you'll have to pay out of pocket before the insurance kicks in for outpatient and doctor care, will also jump 12% from $257 to $288. Now, that affects both original Medicare and Medicare Advantage users. I'll put some links to articles in the notes below, but I went out to the trustees report itself to review the data, including this table VE2 on page 204. And in fact, I looked at this same table on the last several trustees reports to compare data. The 2025 projections here in the top blue dotted line are on a much higher path than in recent years. That solid gold line, for instance, is the projections from the 2024 trustee report. When you look at the 2026 projections from the 2017 through 2025 trustee reports, you can see that the 2025 estimate is an outlier, significantly higher than prior years. Official Part B premiums and deductibles will be announced in late October, so these are just estimates from the trustees report. If you're on original Medicare, you can also expect double-digit increases for Medigap plans, which cover the 20% that Medicare doesn't. For example, Mutual of Omaha's Medigap Plan G could see a national average rate increase of over 20%, while its Plan N is about 18%, just a little bit lower. I'm going to be watching for my annual notice on my Plan N. Now, as a reminder, when you join Medicare, you elect either to sign up for original Medicare's Part A and B and a Medigap plan, or you sign up for a private insurer's Part C Medicare Advantage plan. Now, Kaiser Family Foundation reports that Medicare Advantage plans cover 54% of beneficiaries in 2025. Now, these Advantage plans come with lower premiums, but come with trade-offs like limited networks, prior authorization, and higher out-of-pocket costs. Medicare Advantage insurers, most of them are large corporations, and insurers like Humana and Aetna CVS have been scaling back networks and ancillary benefits like dental and vision to focus on profitability according to their own reports to investors. The Center for Retirement Research of Boston College had its own perspective on the trustees report, and it noted a key issue is the Medicare Advantage costs are 20% more than original Medicare due to coding intensity, incentives to add multiple codes for each enrollee, favorable selection with healthier enrollees in the Advantage plans, and these quality bonuses. They give extra money for those plans that have 4 and 5 stars. Now, instead of solving the problem by making Medicare Advantage look more like traditional Medicare, Medicare is going the other way, adding prior authorization to traditional Medicare starting in 2026 for a set number of treatments. Now, starting in 2026, Original Medicare will introduce this prior authorization for certain treatments via its WISER model, and it'll start only in 6 states, but unfortunately, they include New Jersey. Now, for prescription drugs, Part D premiums are projected to rise 33%. The base beneficiary premium for end users will increase 6% to $38.99. Now, that's capped by that Inflation Reduction Act, which I mentioned here. That also includes a maximum out of pocket. It was $2,000 in this past year, and it'll be $2,100 in 2026. Now, I did mention again in that video here that we would all be paying more for our Part D plans. If you're not yet on Medicare and using the ACA Marketplace, brace for the median premium increase of about 18% or 20% on average. That's across the 312 insurers, and that's from a study that the Peterson Center and Kaiser Family Foundation conducted. Now, among the reasons cited by insurers were rising healthcare costs, inflation, labor costs, contracting changes, provider consolidation, some specialty medications like Ozempic and Wegovy, tariffs, and this strange rationalization. Insurers say the end of enhanced tax credits will drive premiums an average of 4 percentage points higher than they would have been otherwise, because insurers anticipate that some healthier members will leave the ACA marketplaces. Hey, here are 5 practical steps a smart retiree can take to control healthcare costs next year. First, shop and compare plans during the open enrollment periods, and that's October 15th through December 7th for Medicare and November 1st through January 15th for the ACA plans. And make sure you use tools like the Medicare.gov's Plan Finder to compare premiums, deductibles, and coverage. And you also want to make sure that you use those tools yourself, even if you use a broker, since some insurers are cutting back on broker commissions, which may limit their recommendations. Now, ACA users should use healthcare.gov or your state plan to shop carefully to offset the loss of enhanced tax credits. Second thing is to explore low-income assistance programs. Now, check your eligibility for Medicare savings programs or extra help, particularly on the Part D coverages. ACA users might qualify for state subsidies or Medicaid if your income drops low enough, although I would recommend staying away from those levels. Contact your state health insurance assistance program for free guidance. Strategic withdrawals from your taxable or tax-free accounts can help you qualify without overly restricting income. And again, you'll want to stay above Medicaid levels maybe. Unless you need to, do it constructively and strategically. You'll also want to optimize your prescription drug costs, and that starts with talking with your doctor to explore generics or biosimilars. Make sure you're armed with a list of drugs that you'll take next year in 2026 so that you can use those Medicare Plan Finder to compare the total cost of drugs for the whole year. And you'll do that if you're a Part D plan coverage or a Medicare Advantage plans. Shop with all of the drugs that you need so you're getting the best drug costs. Now, if you're enrolled in a 2025 Medicare prescription payment plan, which allowed you to stretch out the payments throughout the year, you're going to auto-enroll in that in 2026 unless you opt out. So watch out for that. ACA users should check their plan formulas carefully and also consider the pharmacy discount programs to see if they might help. Also, leverage preventive care and wellness programs. Both Medicare and ACA cover screenings, vaccinations, wellness visits at no cost. Take advantage of those to catch issues early and reduce future expenses. Now, Medicare Advantage also have those sneaker fitness programs, but confirm what you're going to get in 2026 because those are among the things that are optional for the insurer, and they may be cutting back on some of those extras. And finally, consider switching coverages carefully. Weigh Original Medicare with Medigap against a Medicare Advantage plan. Now, Original Medicare offers broader provider access anywhere in the United States, but it comes with higher premiums, while Advantage plans have the advantage of lower premiums but restrictive networks. Now, switching back to Original Medicare and Medigap later may require medical underwriting for your Medigap plan, so unless you're in a special guaranteed issue period, do it carefully. Compare costs and provider access before you decide to switch. These steps require some planning, but they can help ease the sting of rising costs in 2026. Start early during the open enrollment periods and use your free resources like the SHIP counselors, Medicare.gov, and Healthcare.gov resources. I'll be updating my Get Ready for Medicare playlist starting in late September as we prepare for my wife Marie's Medicare coverage to begin in 2026. Follow me here on YouTube and X at I Was Retired for more DIY retirement tips. What's your reaction to the 2026 cost increases for healthcare? Drop me a comment below and take a moment to like, share, and subscribe to this channel. As always, I'll note that I am not a Medicare broker or a financial planner. I'm just a DIY retiree sharing ideas. Always do your own due diligence and seek out a professional if you need one.